talking about, again, and I will get to the results of the study, but I wanted to tell you about the products that we used on these patients. And this is a question I should have asked everyone, but if you want to go ahead and chat that to me now, how many of you are using a dry eye compress? We talked about earlier the importance of the meibomian glands, the glands in your lids. Well, what is it that can open up those glands and get them flowing again? Because if they don't produce, they actually will close over and go away. So that is the risk here. And when we do clinical studies, in this clinical study in particular, there were several patients, who had almost all their glands gone in an entire eye. So they might have 2 or 3 glands instead of 30. So you do not want that because you'll be using eye drops for the rest of your life. So multiple studies have proven that this can increase the lipid layer and improve tear breakup time. That's how long it takes for your eye to start tearing. But you really need to get that compress or the temperatures needed to open up those glands. I'm going to talk about a little more, but it has to be over 40 degrees C. So you're talking over 110, 120 is about exactly right where you want to be. For 5 minutes will really open up those glands. So how are ours different? I saw some seeds and some other things in here. I see some that are using ours. That's great. Okay. So what makes ours different? So the key to getting heat to penetrate into your eyelids and into your glands is moisture. There's a big difference between dry heat and moist heat, right? We all know that. We all say, Arizona is dry heat, so 120 degrees you can handle. But if you were in Florida and it was 120 and humid, man, that's really tough. And why is that? Because the heat penetrates quite a bit more. And I'm actually going to show you a data point on that, but it's like 35% more penetration of that heat, which actually increases blood flow, which is what happens when you heat up tissue. You're actually dilating the capillaries and getting more blood flow through. Well, why is that good? Well, it's good for inflammation, to get more blood through, more nutrients, more oxygen to try to heal that tissue. And that's what we're trying to do. So our compress weighs typically twice as much as others, so delivering more moisture. But more importantly, we have this feature called hydro block, which actually blocks the steam from coming out the front and pushes it back to your eyelids. So that's why ours delivers 10 minutes of heat and moisture when others don't. They really don't. You're talking a minute or 2. And here actually can show you this blue line here. So here, first of all, here's the temperature, the red line here. So 120 degrees I talked about is just perfect. And this is 10 minutes. And then 95% humidity, almost for that whole 10 minutes. 5 minutes is all you really need. You're going to get all the benefit out of 5 minutes. And you see here is a good clinical study was done. 35% increased blood flow, 35% more than dry heat. So moist heat, 35% more blood flow. And that's really the key here. And just one more to kind of really beat this message home. We actually used thermography, so a camera that can measure the temperature of the device, of your face, of your eyelids. And what we found, so starting temperature about 99 degrees, and then wearing our compress for 3 minutes, it was 124 max when it was placed on the patient. So 3 minutes. And when we remove the compress, you can see this bottom picture, the actual eyelids were 106.7, so almost 107 degrees. Increased the eyelid temperature almost 8 degrees. So believe it or not, there is a clinical study that shows, not ours, somebody else's, that if you can get the meibomian glands up to 106.7. And that was a complete coincidence. Did not know that was the exact temperature. 41.5 C, that is the optimal temperature to melt meibum. So you're trying to melt the meibum that's congealed in those glands and get it flowing again. And that's what our compress will do. There isn't another compress that can do this, that can raise your eyelid temperature 8 degrees. So, and just one more data point